Get a side by side here. Okay, side by side now. All
Right.
right. So we'll just wait a few minutes and wait for people to kind of get into the room. How are you
Okay.
feeling?
Okay. A little tired, but
Okay.
hey, can't
Okay.
complain.
All right. They say there's no need to, huh?
No need to.
Is there like
No need.
a song about that?
Yes. No need.
Absolutely. Absolutely. How's your week been so far?
So far, so good.
Okay.
Did a lot of relaxing. Some of these side effects probably trying to creep up on me a little bit.
Okay. So we'll
Oh
definitely
yeah. I was
talk.
just.
What was that?
I was just relaxing
Okay.
this weekend.
Okay. We
Oh
can't
yeah.
be we can't be super women. We try to be super women, but sometimes you have to listen to that
Oh
body and
that.
relax.
Exactly.
Absolutely. Absolutely. Let me see here. My co-host Stacy is tuned in here. Alrighty, so I just wanted to welcome you. I just really just want to just thank you for tuning in and thank everyone for tuning in with us. We have a special guest with us tonight, Miss Kiana Smith, who
Hello.
I call you a warrior. So I have coined you the triple negative breast cancer warrior. And
Yes.
I'm just really happy to be on this journey with you and to that you have decided to use 2OBs as the venue to share your story. So thank you for that.
Thank you for having me.
All right. So we're gonna just wait a few more minutes for people here. Looks like Dr. Stacy. I'm gonna see if I can patch her in. I'll
Okay.
try it. Let's see here. Mhm. Yeah, I don't think that's gonna happen. Okay.
I know
Oh,
all the technology, right?
all right. So we actually do have a few people here. We have Miss Julia Spearman here. Your sister Tracy's in the house. Hi, Tracy.
Hi.
Dr. Stacy is here. Rosemary Taylor's here. Thanks for joining us, everybody. She said, "Little sis, stay strong." So she's giving you the.
All
All
right.
right. She is absolutely strong. Your faith is like simply amazing. Simply
It has to
amazing.
be no other way. You cannot do this without it. You
So
can't.
can you just tell me a little bit about like how your faith is so strong in regards to your current journey?
Well, my grandma always told me, Kiana, read your Bible. And this is not my first storm. I've had, other storms in life, not quite like this before. And I dug into my Bible and it got me through the storm. So I knew where to go.
Awesome. That's a great
And
book there.
it's working. Believe me, I don't know. I'm not doing this on my own. I'm 6 treatments into my chemo, a very strong chemo. And guys, the Lord is just waking me up, and no side effects, just a little, fatigue. And my hair. This is the big reveal. My hair is gone. Oh well,
You look simply amazing.
right.
You
Thank you.
you have the head for that.
Yeah, I'm not putting on lipstick right now. I don't.
Okay. Well, you look absolutely beautiful. Absolutely
Thank you.
beautiful. And thanks for taking the scarf off and just showing everyone, what you're going through
Yeah,
with the chemotherapy. I really do
yeah,
appreciate you bearing it all. So
yes.
we're
And
going to
so
bear it all tonight.
I really would like to, start off, let everybody know kind of how this went for me and a little history about myself, if that's okay. Do we have enough
Absolutely.
on? Or?
Absolutely. So we have we can maybe, if you want to start, that's fine. We have a
Oh,
handful of people here. So if you want to go ahead and get started, and we always rebroadcast it. So people
okay,
that are not here, we can always share it with them.
okay.
Tracy says that you are beautiful
Oh,
still.
thank you. Yes, thank you. So I'm 41 years old, and I consider myself very healthy, and this is what probably blows a lot of people. I had no health ailments. And when I tell you, girl, I was in Chicago. Look, I live in Milwaukee. I was in Chicago at a turkey party, and Cookie's singing, "Hey, Cookie!" And guys, this has changed my life in all in a matter of a month. So here it is. I was laying in the bed one night, okay, and laying flat, and I was just I don't know what told me to do it, guys. I was just, rubbing around my breast, and I felt a lump right by my breastbone, and it was, maybe about a pea size, not too big. It's 1.7 centimeters to be exact. And so, I decided to go get my mammogram, and they did an ultrasound, when I did my mammogram, and they saw a mass under my left breast and like a mass under my left armpit. So I got my biopsy, you all, and that was September the 3rd. September 6th, I got diagnosed with stage 2, grade 3 triple negative breast cancer. Yes. And it has just been doctor's appointments and chemo and the Bible for me.
Okay. So your friend Brandy has actually joined in. She's sending her love, and she says you're gorgeous. Thanks for joining us, Brandy. So I just wanted to just talk a little bit just about triple negative breast cancer. You can feel free to chime in and just kind of share more about it, Kiana. So triple negative breast cancer. So basically in the breast, we have multiple receptors. The cancers that we typically learn about and hear about are usually receptor positive. So the receptors that can be present are estrogen, progesterone, and something called HER2/neu. It's the human epidermal growth factor. And so in Kiana's case, all of hers are negative. The special thing about this cancer is that it can be aggressive, and it affects Black women 2 times more than our white counterparts. Also, young women. So it can affect women who are less than 40. There's thought to be over 200,000 cases of triple negative breast cancer every year. So this is definitely a very important public health issue that we need to continue to address. Also, in regards to mammograms, I think we have to be persistent when we go and see our doctors about getting that mammogram, especially if you're less than 40.
Yes.
And so Kiana and I were actually talking on Friday about how to redefine routine.
Yes, because that's just not true. It's so many different avenues. I think that people are getting this cancer. It's not just hereditary, and I think that's probably where they got this guideline. If it's not hereditary, you wait until you're 40, but it can be environmental. It can be, I don't know. So that's wrong. You shouldn't wait until you're 40. Like, what age are people getting diagnosed at your clinic?
So the youngest patient that I've seen was 25 years old, and she had no family history. I actually met her because she actually just had a baby. And so when they were signing her out to me, they were like, oh, we have this patient here with a history of breast cancer, and she's 26. So of course I go over to check on her to find out more about her diagnosis. Mm-hmm. And really there was nothing that you could really link it to. So I definitely think there's some environmental component, something in the food. I mean, we have all this food that's now genetically modified. But there's also other factors, things such as tobacco. I think our lifestyles, like we're more sedentary. So as kids, it's like we were always outside and we were out moving. But now we have this issue with so much obesity. So definitely, if you have a lump in your breast, and actually I have some breasts here tonight. I was at I had a guy come up. He's like, "What size is that?" But I was at a health fair yesterday out in Phoenix in the south suburbs. So I grew up in Harvey. And actually had these breasts here for people to figure out exactly how many lumps are in the breast. And so one of the things now is that our governing body, I'm an OBGYN for those of you that don't know me, and my governing body is currently saying that we should start doing mammograms at age 40 and do them every year in patients up until 75, or you can do them longer if the patient, depending on her health status. And so this particular breast has about 5 lumps in it. There's one really, really tiny one up here that a lot of people just could not find. So I do have an actual picture of like, this is where all the lumps were located in this breast. And so it's super important to make sure that you also check below your nipple. Mm-hmm. And so you have to make sure to cover the entire breast. And also the breast tissue starts in your armpit or your axilla. So the talus spins is what it's called. And so really just making sure that you get in this area, you bring that arm up behind your head And I would recommend doing it either lying down or in the shower and making sure to cover the entire breast. So you can do circles, lines up and down, and pressure is important. So you should have light, medium, and then a heavier pressure because that's how you feel those little small lumps that are hiding out below the nipple, that are hiding out in the breast tissue, hiding out in the armpit.
And that's right, because I didn't initially, I wasn't feeling around under my arm, and then I could. My doctor said feel it, and you know what? When I applied a little pressure, I could. Yeah, you can feel it.
Absolutely.
Yeah. Mm-hmm.
And then this is an example of another breast that I took with me, and this one has a huge mass right underneath the nipple.
Wow.
And so again, it's really key. I recommend doing your breast exams once a month. If you're having a period, do it the week after your period. If you no longer have periods, then you should do it. I usually say pick your birthday. So if my birthday is October 6th. So I would do it the 6th of every month if I didn't have periods. Okay. So Tracy actually had a comment in regards to the thought that maybe it could be related to food, immunizations, and air pollution.
Wow, that's interesting.
And then not so much DNA. So in regards to DNA and genetics, there's actually thought to be some genetic susceptibility with this condition in regards to triple negative. So it's usually associated with the BRCA1, which is the breast cancer antigen gene that can be seen in the receptor positive cancers. And so roughly 20 to 30% of women can have the BRCA1. Now, have you had genetic testing done yet, Kiana?
I did, and they have this wonderful Cancer Next is the one that I did, and they actually tested for BRCA1, BRCA2, and it was also like 20 other cancers.
Okay. What were some of the other ones?
Let's see, ovarian, colorectal, uterine, pancreatic, prostate, stomach, melanoma. Yeah. Okay. Yeah. And it came back negative. So, yeah, that was pretty interesting. So, and they say only 5 to 10% of cancer is hereditary with people who have a history, family history anyway. So,
okay, excellent.
Yeah.
That's excellent. So Tracy says that she will be getting her genetic testing done this week to check for her markers. Yay, Tracy.
Very good.
That's excellent. Excellent. Also, just one of the things, like if you have a family history of breast cancer, the recommendation is to start doing your mammograms earlier. For instance, Kiana was diagnosed at 41.
Yes.
And so we would recommend that your daughter start at 31.
Yes.
So 10 years earlier than when her mom was diagnosed.
Yes.
And even if a doctor tells you, you should wait until 35, you just have to be adamant that, you need to get that done 10 years earlier than when your primary relative was diagnosed. So primary relatives would be like your mother, your sister. Mm-hmm. Those would be considered primary relatives. So Brandy wants to know if the genetic screening is covered by insurance.
And you know what? That's a great question. Most insurance probably you'll have to check because I'm not sure. Again, it's one of these routine things that you can do. So, because like, I don't know, can you go in there and just say, hey, somebody in my family had cancer. Can you give me a genetic test? I don't know. So that'll be something that you'll have to ask your primary care provider.
So was yours covered by insurance as far as you know?
Well, mine, yes. Okay. I have Blue Cross Blue Shield and PPO. Yeah.
Okay. Perfect.
So, yeah. And in this little book, should you have genetic testing, I just want to run through these little 5 questions and say if you answer yes to any of these questions, you should talk to your provider because maybe you'll benefit from getting this test. Have you and your family members been diagnosed with cancer? Less than 50. Have you and your family members been diagnosed with more than one cancer? Have you or your family members been diagnosed with cancers, tumors that you have been told are usually rare, such as ovarian cancer? Have multiple people in the same side of your family had cancer? And have any of your family members been found to have a cancer gene mutation? So if you answer yes to any of the questions in this pamphlet, you might can talk to your provider to see if this is something that you can get.
Also, if you have a male family member that has been diagnosed
Yeah.
with breast cancer. So we're actually now starting to see a little bit more in the news now that Matthew Knowles, who was the father of Beyonce, he was diagnosed with breast cancer. And, when I was at this fair yesterday, some men would come by the table, but for whatever reason, they act like they're afraid of breast. And so, I started telling them, like, that men can
Yeah.
also be affected by breast cancer. But as soon as they heard that, they ran from the table. So I just think that knowledge is power. And
Yes.
so they shouldn't be afraid. Like, even as women, like, do not be afraid. Play with your boobies.
Yes.
We have to know what's normal. And
Yeah.
someone actually had a question about dense breast. And so lumpy breast. And so it makes it a little bit more difficult to do a mammogram when you have lumps and bumps. But it's important that you know what's your normal lumpiness versus like something that's abnormal. And so what I usually recommend is like when you're doing your breast exam, you're looking for something that's hard like your knuckle or something hard like a frozen pea, and it's something that's it doesn't move. It stays
Mhm.
stable. It sometimes may be painful. It may not be painful. But if there's anything that seems out of the norm for you, you should definitely see your gynecologist or your primary care physician.
Yes, and push because now, Dr. Erica, do you always feel a lump?
Not always. And so if a patient comes to me and she tells me that she has pain, I'm going to order the mammogram. If a patient is young and she comes in and she has a lump that I feel, usually we'll start with an ultrasound in someone who's less than 30. But if they're 30 and up, I always would start with a mammogram, and I do both breasts just because it
Okay.
could be something that's very small that could possibly be missed. I actually had the chance to speak with your sister today,
Okay, great.
who is a breast cancer survivor. She's 7 years out currently. And in her particular case, she said there was no mass. She started doing her mammograms every year, starting at age 30. And at age 40, 10 years after starting mammograms, they actually picked up very, very small area that was abnormal on the mammogram. And from there, she went in and ended up being diagnosed with stage 1 breast cancer.
Mhm.
So her journey is a little bit different than yours, Elise. She was actually estrogen receptor positive,
Mhm.
and she caught it very early. And
Mhm.
she opted for a bilateral mastectomy. So she ended up
Mhm.
having both breasts removed. She didn't require any chemotherapy, no radiation afterwards. And then she also did the breast reconstruction.
Mhm.
And pretty much, I think everybody's journey is different in regards to the stage and the
Yes.
grade of your cancer, depending on what treatment methods you may
Yes.
need. And then
Yes.
also just in regards to if you are receptor positive or negative. So that also makes a huge difference in regards to
Huge,
your treatment and outcomes.
huge difference. And that's just the whole point of being triple negative. They don't have targeted therapy for me. So I'm just getting like a full systemic chemo, and we're hoping that I can get a complete response for it. And that's the whole thing about the triple negative. It's negative for those receptors. The estrogen, I don't have that key, that lock to, kill that cancer. Progesterone, they don't have the keys, the targeted medicine that can eradicate that cell. HER2, I don't have any of those. So my chemo is just, a little different. We're hoping that we get a good response.
So there was actually a couple comments in the interim.
Mhm.
So Tanisha Charmaine states that when she was younger, her doctor at the time had a model breast. The breast had different types of lumps, large, small, and multiple. She has not seen this used anymore with current doctors. And so that's one of the things, is that they're telling us that we shouldn't teach patients to do the breast exam, the self breast exam, because that causes more anxiety. So if you find a lump, because a lot of women do have naturally lumpy breasts, so then it's making you more anxious, and then we're probably ordering more tests. However, I just think that education is key. And so even when those guidelines came out, I was like, I'm going to continue to use the breast. So this is something that I use in my office. Dr. Stacy is here, and she states that she also uses these models in her office.
Yes.
And so I think it's just important that, get comfortable with your breast.
Yes, you have to. It's important. It's a lifesaver because that's the whole thing. You need to catch it. You need to catch it. If you catch it too late, it's just a whole different story. And
Absolutely.
so, like I said, mine stage 2, it came out of my breast already. It's a couple in my lymph nodes. Had I not caught that, that thing would have just started traveling anywhere.
Right. So just in regards, just to talk a little bit about the stages. So in regards to Kiana's stage, she's stage 2. And so staging can be based upon size and then also if the lymph nodes are affected. So in Kiana's case, the fact that she has lymph nodes puts her at a stage 2. In general, the stage 2, the size also matters. So between 2 to 5 centimeters typically, and then lymph node invasion. And then grade
Yes.
3, so
Yes.
there's 3 grades of cancer. So your grade 1 looks very similar to normal breast tissue. Grade 2 is somewhere in between, and grade 3 looks abnormal compared to normal breast tissue.
Yeah.
And
And the
so it,
most aggressive, the aggressiveness, one, two, three, and it is how it looks.
exactly. So
Hmm.
Tanya Taylor actually tuned in, and she stated that she started having mammograms and ultrasounds at 26 due to family history. And
Okay.
she also had the BRC test done around that time, and she gets checked every 6 months.
Oh wow. Okay.
So, Tanya, if you could just share with us if your BRCA was negative or positive, and if you had any family members that had, like, which family members had breast cancer? Was it your mom or grandparents? Because in your case, it's your sister, your
Yeah.
grandmother, and
And
a
my.
maternal aunt, right?
Hmm.
Okay.
And I'm not sure. My grandma, we didn't get enough information from her. My auntie, she really didn't know too much,
Okay.
either. And so, but I know my sister, we both tested negative for BRCA
Okay.
for the genetic testing.
Okay.
So,
After talking with your sister, she did state that she actually started doing mammograms at 30 because of the family history, because of your grandmother and your aunt. And she shared with me in regards to your grandmother's breast how the doctor saw that the cancer had been present for at least 14 years, just based
yeah,
upon the size of the breast at the time of them noticing it. That I guess she
yeah.
was a very well endowed woman in regards to breast, and so it had basically shriveled up
Yes,
and
and
looked
she
very
believed
prune like.
in the Bible. She didn't want to tell us. She didn't tell us because, we would have made her, get to the doctor. She probably would have, had all. She didn't want that. So I don't know how she did it, but she did it. She lived on her own up until like 3 days, and then
Okay.
she passed.
Okay. And
Yeah,
then it sounds like your aunt, I think Elise was thinking that she's probably in her 80s now, so she's about a 20-year survivor
yeah,
at this point. And,
yes,
and that's the thing in our community, especially. I think we need to talk more about health issues that we experience.
and history,
Absolutely.
yeah,
Because, I mean, how many people have that story of Big Mama was diagnosed with something, but we don't know what, and we'll never talk
no,
about it, or they get sick, and it's like, don't tell anybody that I'm sick. I don't want
hmm,
anybody seeing me sick. Don't bring them to the
yeah,
hospital, and you get in trouble for sharing
yes.
the family health secrets. But those are
Yeah.
secrets that we need to get out because that may prevent someone else from going down that road.
And it's here. And I think I call it an epidemic. I mean, my eyes are. I'm a respiratory therapist by trade, and it's Respiratory Care Week. Hi.
All right, happy Respiratory Care
But
Week. Thank you, and we appreciate you.
yes, and now that I'm in this thing, something is wrong. Something is wrong. It's way too many people coming up being diagnosed with this. And yes, it's a good thing that, medicine and everything, people are living with it, but, you're living with side effects and everybody don't catch it early. And that's the danger of it. Hmm.
Absolutely. So again, early detection is key.
Yes. Yes, it is. Hmm.
Okay, let's see here. Tanisha Charmaine, maybe referring to it as breast chest cancer. Maybe more men will start to take it more seriously.
Hmm.
I think that's a
Yeah.
great point.
And I'm looking forward to seeing how this men cancer evolves. We have to, we have to get on these insurance companies, our government. We need to know why these things are occurring in our body.
Right.
You know, got to do better. We got to eat better.
We do have to eat better. We have to eat to live instead of living to eat. And I think in moderation, definitely
Yeah.
moderation. So some of the things that can increase your risk for breast cancer, especially the triple negative, would be, of course, family history. The mere fact that you're a woman, your risks are going to be much higher. Smoking, alcohol use, obesity, if you've never had children. So also if you delay childbirth to after age 30. And then things that are protective, more kids, that seems to decrease the risk. And then also breastfeeding is thought to be protective as well.
Yes.
And so some of those things are modifiable. We can modify our obesity. You guys, I guess you
Yes.
can modify your purity too. So get pregnant at less than 30 if you if you're ready for that.
Yes, I agree. I
So
agree.
Tracy says that both of her sisters are blessings, fighters, and inspirations.
Yes. Yes. And then, I know, like, I just have such a heart for it's not only breast cancer, Dr. Erica. I mean, how many people do you see with cervical and ovarian cancer coming in?
Right. So cervical cancer is actually, we're starting to see a decrease in cervical cancer just because we have
Right.
the pap smear. And so, I do some travel to like international countries. So it's definitely more of an epidemic in some of those places where they don't have access to routine pap smears. But not to say, like, I have diagnosed some women who've come in where my last pap smear was when I had my baby and the baby's like 45. And
Oh, wow.
so women, it's important. We start to get our pap smears starting at age 21. And the current recommendations is to do it every 3 years from 21 to 29. Starting at age 30, if you do the PAP alone, it's every 3 years. And if you're testing for HPV, which is the human papilloma virus, and the PAP and the HPV are both negative, then you can go every 5 years. But if you have abnormalities in your PAP smear, you should get screened more
Mhm.
frequently. If you have HIV, you should be screened more frequently. Also, risk factors that can increase cervical cancer would be things such as tobacco. So it always goes back to tobacco.
Mhm.
Sex at an early age is also thought to be related. Also, multiple sexual partners, and so those are things that we can definitely prevent. It's thought that if you use condoms, that can help prevent the transmission of the HPV virus.
Mhm.
There's also a vaccine, so that's something you can definitely talk to your doctors more about. But definitely, get your pap smears, get your annual exam. So even if we're saying do the pap every 3 to 5, I always tell my patients, don't run away. I still want to
Mhm.
see you every
Mhm.
year. I still take a
Oh,
look just to make
wow.
sure there's
Okay.
not something that looks abnormal to me, or make sure
Okay.
there's not any abnormal bleeding and things like that. Because that's one of the key signs of cervical cancer. You get this abnormal bleeding. And so I actually ended up diagnosing this woman who hadn't had a pap in probably 40 years. And
Wow.
just in the pap smear, just looking at it, I was like, this is not normal. I
Okay.
mean, because really, it's like the tissue was very friable, like really, it was like shredded meat almost, and so that's not normal at all.
Okay.
Let's
So
see
it looks
here.
like we need to get the tops and bottoms in every year.
Absolutely, and then you mentioned colon cancer too. So colon cancer, you should start getting screened with your colonoscopy, or sometimes there's a blood test, or they may have you give a stool sample. But in African American population, you should start that at age 45. Just because once we get breast cancer, it's usually more aggressive by the time they catch it. If you're not African
Exactly.
American, you should start at 50. And so I think a lot of people are afraid of like, oh, I don't want to do the colonoscopy. They're not placing this camera, you
Mhm.
know, in my bottom.
Mhm.
So I think we just have to get over some of that fear, and then I guess we have to also think about what causes some of this fear of the medical society.
Yeah.
And so if we go back to, let's say, we can take it back to slavery. There is an
Mhm.
excellent book by Harriet A. Washington. It's called
Okay.
Medical Apartheid. In this book, she talks about some of the different gynecological procedures that were developed. And at this time, um, they were tried out on slaves. And it was the thought that slaves didn't feel pain.
Mhm.
And like the speculum that we used to do pap smears with was designed by a guy named James Sims. He's the father of gynecology, and he is the one behind many of the instruments that we use today. And he had a statue erected in his honor in New York, but they actually took it down just because of all the pain that he put slaves through, stating that they don't feel pain.
Oh.
And then if we fast forward, then we have our Tuskegee syphilis experiment,
Mhm.
where men and women, it was actually men who were infected with syphilis, and they knew that there was a cure, that penicillin could cure syphilis, and that was withheld from them for, I think, from 1940s to the 70s. Actually, President Clinton actually issued a apology to these families. I think that was in like the 90s. And
Yes.
so I think, that distrust. So I think that we just have to find someone that we feel comfortable with as a physician so that you
Yeah.
feel like you're getting adequate care, that your feelings are being heard. Can you just tell us a little bit about I know you said you had two opinions and your
Yeah.
recommendation is to have a second opinion when you're diagnosed with a cancer.
Yes, it's just very important for peace of mind. And I did. I'm out here in Wisconsin, so I'm at Freighter, and I also had a second opinion out there in Park Ridge, where a doctor actually worked at Northwestern and is in the advocate system. So I kind of got, the best of both worlds there. And lo and behold, they had the same plan.
Okay.
So that just gave me put me to rest. You know what I mean?
Okay.
Because different doctors can have different plans. And so
Absolutely.
you have to do a little reading and you have to do some homework yourself. And I tell people that all the time. Stop just listening to what people say and do some homework. It's all in the books.
It is. It is.
Google is good for something other than junk. hmm
Okay.
So, yeah, you have to get two opinions. And the insurance will code, your bill as a second opinion.
Okay, perfect. So just in regards to, can you just lay out for us what your treatment plan is?
Okay. Well, it's called neoadjuvant treatment. And what it is I'm getting my chemotherapy first. Okay. Normally, you'll have surgery, then you'll have chemo, then you'll have radiation. Mine is split because they want to see what is this chemo going to do for her cancer. You see what I'm saying? Because I don't have those receptors, remember? So I have to see what this chemo is going to do to my tumors. Then I'll have surgery and then radiation.
Okay. And then in regards to the chemotherapy, are you having any symptoms at all? Because we all hear about, the nausea, the vomiting.
I think I'm coming up on a couple. I'm on my 6-1 is coming up Wednesday, and I'm not having any. Only I'm getting a little fatigue. And I'm starting to sweat a little bit at times, but they say it could throw me into early menopause. And then my hair. So that's the only thing that I'm dealing with right now. But each person is different. It depends on how healthy you were before, and a lot of different factors. So I owe it all to my Lord.
All right. Do you have like a go-to Bible verse?
Yes, Proverbs 3:5.
Okay.
Trust in the Lord with all your heart and lean not on your own understanding. Because diagnosis like this, if you try to understand it yourself, you'll be trying to get that marijuana out there.
Well,
You'll be trying to drink.
Well, it's going to be legal come January, but and it's some thought that it may have some merit in regards to medical treatment. I mean, you have to get the stuff, not the stuff probably that these kids are smoking, but the pure stuff from the lab.
And I'm glad because I did ask. Now I never smoked none of that in my life, but I did ask my oncologist, and he said no. I can't drink alcohol.
Alrighty.
I can't do medical marijuana.
Okay.
No, I said, what about CBD?
And what did he say about the CBD oil?
No.
Nothing.
He doesn't want anything to interfere
Okay.
with the chemo. I don't know if it's the type I have or I don't know, but no, he doesn't.
How's your appetite? Because I know that sometimes that's one of the things that people will sometimes use the marijuana for the nausea and vomiting and to improve their appetite.
Believe it or not, girl, the Zofran right here. I only take Zofran, and that's for nausea 2 days after my chemo.
Okay.
But then I don't need it. So I'm doing pretty good with nausea. I'm eating pretty well. I'm starting to feel like I don't want to eat. My appetite is tapering off, but I have to force myself. Okay. I'm trying to keep myself busy, take walks, and you still got to exercise a little bit. You can't you'll feel worse if you lay down all day.
Absolutely. And that's one of the things that they're really pushing for: moderate exercise, which could be a 30-minute walk a couple times per week, making sure you're maintaining good nutrition because that helps with optimal outcome. And I think
change my diet.
Okay, that's great.
Change my diet, fruits, vegetable, no sugar. I see people on the Instagrams and stuff going through cancer and they're still eating cakes and cupcakes and stuff. Now, I thought, do sugar feed cancer cells?
I mean, I think it
I,
would. I think
I
they need
thought,
something to feed on.
I
I think the
had,
healthier your diet is, the better as in
yeah,
regards to your health outcomes.
yeah. So I don't, I'm trying to do better. Or trying nothing. I am. I
Okay.
have no choice.
So is the whole family eating better now? So,
Oh yeah,
okay.
yeah.
Okay. Okay.
It's what you bring in the house. Starve or you
Absolutely.
live.
Okay.
Yeah.
All right.
Water is very important. I try to get like 8 bottles of water. I'm not quite at 8. I'm like around 5.5.
Okay.
But you have to flush it out your system.
Okay.
That chemo out your system.
So you want to just talk a little bit about that? Because I think a lot of people may not realize like some of the precautions you have to take when you're
Yeah.
on chemotherapy and to protect your loved ones.
Yes. So when I go to the toilet, y'all, and because it's toxins, okay. So I have to flush twice. You know what I mean? You have to be very sanitary. You got to keep all that stuff clean. It excretes through my sweat. It excretes through my saliva. So you have to be very careful. Sexually, ladies, how people just out here having sex and you don't even know what people got or going through. Look, with this chemo, you can't have unprotected sex. You cannot be doing stuff orally with your mouth. I mean, I don't know how many people out there on chemo still, because it works.
And that's one of the things they talk about, like the chemo decreases your libido. Have you, if you don't mind sharing, has it affected your libido at all?
No. And it's funny because I talked to my sister, because one of my sisters has lupus, and she was like, "Yeah, that's the only thing that worked." They don't have no problems. It was like, of all things, that down there is still acting, still acting right. I
Okay.
think what.
All right. That act right. Okay.
And it's still life changing though, because I had to look in the mirror. I was used to hair.
Okay.
You know what I'm saying? You look in the mirror. I'm not used to. You see, girl, look, it's crinkly. Look at this.
Girl, you got a perfect head. Your mama must have shaped your head when you were delivered. She got that head, and she she shaped that head.
So you go through a little, but you know what? My husband, he is awesome. Look, when you have people, I've been with him since I was 15.
Wow,
girl, you know
lifetime.
what I'm saying? And it's genuine. And then if you're going through something like this and somebody have a problem, bye.
Right. Exactly.
And so, I'm glad. Thank you for having me on here, because I just want to let people know, because people may say, okay, she got cancer, she think everybody. I'm worried about everybody.
Absolutely.
Because this stuff is happening too rampantly. Everywhere I go, I hear somebody of a new case.
Right. And I know you started an Instagram group.
Yes, I did. It's still in infancy. My Instagram page is Live Better _W Live Better
with faith
_W _faith. Live Better with Faith. And it's just me. Let's just do better, you guys. Let's pay attention to what we put on our bodies. And let's go get checked regardless of the age, they say. Just every year, go get your tops and your bottoms checked, because that's all you can do, and it makes the world of difference. We don't want to keep dying from this kind of stuff.
You're absolutely right. And again, I think knowledge is power. I think someone had just made that comment as well, that knowledge is power. And
it really is.
And so if we don't go and get checked out, we have all the tools at our hand, and we have our faith, but it's just like God also gave us 5 senses. So you have access to medical care. I know you had mentioned how, you also recommended getting it done at like a center where, is it Freighter is what it's called up there?
Yeah, up here, we're the big teaching hospital up here, Freighter. Mm-hmm.
Okay.
And I'm sorry, because I don't know, it may be some people on here, but I like the bigger hospitals when it comes to something serious like this.
Okay.
I mean, because I work, and some of the smaller hospitals, even by me being a respiratory therapist, some of the smaller hospitals don't have the machines and stuff that we can use. Right. I don't know, it's a disparity.
I can definitely understand that. And also just making sure that, some people hop around. I met a woman over the weekend, and she hops around for her mammogram. She said mammograms at 3 or 4 different hospitals. And the thing about it is that, like you're saying, like each scan may not be equal. And so it's important. Usually they'll ask if you can bring that scan from the other hospital. So at least they
Yeah.
can have a comparison, especially if you're someone who's had an issue in the past with, a mammogram, or maybe you've had a lump on your breast or something like that. It's super important
Yeah.
that they have a comparison. So try to
Yeah.
find one hospital, one doctor that you just kind of just stick with. Because that was one
Yes.
of the things, and I was talking to your sister earlier about if she ever had any pushback about getting her mammograms at 30. And she said just
Mhm.
after she told them about her family history, she never had an issue.
Mhm.
However, we were talking about her daughter and how she needs to start having her mammograms at
Yes.
30. And her
Yes.
gynecologist was like, no, you can wait until you're 35.
See,
And we're
don't
both
let them
like,
do that to y'all.
it's time to find a new
Don't
doctor.
don't let them do it. Don't let them do it. And then if you have to go in there and say, "Hey, I'm having a little pain or something,"
Absolutely.
it's life or death, and I don't want anybody to have to go through this. They put your lifespan on you. Oh, well, Kiana, there's a 80% chance of a 5-year survival.
Okay. Okay.
You see what I'll be in here.
Right, your faith. That mustard seed of faith, Matthew 17:20. It's a small
There
little
you
bit of faith
go.
is all we need.
Thank you. Nobody's gonna tell me what my lifespan is gonna be. Thank you.
Okay.
Thank you, though.
Okay.
So,
Okay.
and another thing I just wanted to touch on, I Susan G. Coleman,
Yes.
I applaud her. Okay. Since I've been in this, I've been just doing a little researching and stuff, and things have been on my heart. You guys, when people go through this, there are real problems in life. People, you know, some people can't go to work. They can't put gas in their car. They got kids. They got to buy Pampers and milk. So a lot of people say, well, what do you say? What can you do? And it's, just acts of kindness, guys. You don't have to buy anything. Um, Encouraging words. Um, that's all that's really needed. You know what I mean? Ask them, do they need anything? And I just wanted to, if it's okay, just kind of some things that people have sent me
Tell
that
us
I didn't even know.
tell us about the angel mail. Tell us about how you found out about angel mail, because that's just
Angel,
amazing. The the outpouring of love that you receive from strangers.
girl, angel mail. Now I had like 5, 6 people ask me for my address.
Okay.
So, okay, all of a sudden, and this is how it looks. If you
Okay.
all can see it, can you see it on
Yes,
Facebook?
angel mail delivering kindness, hope, and encouragement.
Yes. And so then all of a sudden, I just started getting letters in the mail from blessings from your angel. Girl, cards. I figured you could use a hug, blow it up and give it a hug. Look at this. Balloons.
That's amazing.
Girl, people look, somebody made this,
Amazing.
with
Amazing.
encouraging words, books. So y'all, let's, I know that, we be raising all this money for these walks and everything, which you should. Some of the money going to research and stuff. But
Where's the other
really,
money going? Do you know where's the other money going? We don't know.
now,
It's a subject for another night.
listen, I like organizations that you can call and get some help from.
Okay.
Right, I think we all, you know what I'm saying?
Absolutely.
You know what? Can we call, because there's millions of dollars in these
Absolutely.
walks and stuff. You're making money off this breast cancer stuff. So we want to make sure that you're really making I mean, I'm gonna get myself in trouble.
All right, we're gonna talk a little bit more about Pinktober at the end of this interview. I just want just a
Okay.
few more comments here. We have
Okay.
Tanya Taylor. She said that her BRCA test was negative, so her genetic screening was negative. At the
Okay.
time, she only had her mom who was diagnosed. She was working at Mass General, so I guess she's in Boston
Yes.
at the time. And that's a great place to be. Like every article I've ever read in the journals, it's always about Mass General.
Yes.
And at the time, her OB recommended that she get tested. This was in 2007. It was a fairly new test at that time. They pushed the insurance company to cover it. They
Okay.
also had her see a genetic counselor, which which, that's the recommendation. Like, you should not just be getting genetic screening. I know one of the, like Ancestry.com, they now have like an addition, also in addition to finding out your ancestry, you can find your DNA ancestry. And so I think it's really important that you have the genetic counseling so that you know how to interpret those results, and you're not just getting some results from a website that leaves you with information, but not how to deal with the issue if it does come back positive.
There you go.
And so she said she saw a genetic counselor, and she now has 3 cousins that have been diagnosed on her mother's side.
Wow.
Her mom was one of 7 girls, and she was the only one diagnosed with cancer.
Oh, wow. Interesting.
There's another question, Kiana. They want to know how many doctors have you seen, have helped you through your journey?
Well, the initial, my surgeon, the breast surgeon, she gave me, my stage and everything. So let's see, my surgeon, then I have an oncologist. Yeah, 2 right now. 2. My surgeon and my oncologist. I see my oncologist every 4th treatment.
Okay.
Every 4th chemo treatment, I see my oncologist.
So how did you make your decision in regards to, I know you said you had the 2 opinions. How did you make your decision upon which facility or which doctor you wanted to use? Like, was bedside manner important? Were there any factors that led you to choosing one organization, one doctor over the other?
And you know what? I think that's pretty interesting because it probably helped that I'm in the medical field.
Okay.
And so, in my opinion, though, I don't lean on either side, because you can have a doctor with great bedside manner and may not be the best doctor.
Okay.
Then you can have a doctor with not too good of a bedside manner, but be the bomb. So both of the doctors, their bedside manner was pretty good. Look, you can't expect a lot of these doctors to be, ooh, I kind of want the job to get done. Okay,
I heard that. Okay. So not looking for a friend, looking for somebody who can get it done.
I'm looking for somebody, and then you do your homework. You do some reading, you do some research yourself, and then you'll know is who fits with your page.
Okay.
Yeah.
Perfect.
So who can answer your questions.
Okay. And you felt like they adequately answered your questions. I know you mentioned there were some illustrations and
they both illustrated. They didn't like taking your own notes. They want to make sure that you know. They wrote it out for you. Both of them. Yes.
Excellent.
Mm-hmm.
Excellent. Yeah. So there's another question. Which family members and friends have been most supportive?
All my family. And even though I'm out here in Milwaukee, I moved out here in April, they're 2 hours away, but we call. That's one good thing about FaceTime and texting, because sometimes you don't always, call. I mean, I feel like, but little emojis. And even my friends, we do like emojis, like, you okay? And I'll do, hey, I'm strong.
Okay.
And I'll give them the heart and the thumbs up. So pretty much everybody, nobody slacked off, but they do warn that sometimes people, do fall off. And probably because they don't know what to say. So I don't take it too hard if they,
It can just be as simple, I'm just checking in on you, girl. Hope you're having a good Monday.
Mm-hmm. That's all you need to do.
Okay. So with the chemotherapy, like when you go in, like how long are you there? How does the process work?
Yeah, so when I go there, I have to go to the lab first. And let me see if you all, can you see a little protrusion
I see it.
there?
I do.
Yeah, so that's called a port, okay? Yes. And so I go to the lab first, and they clean it real good, and then they put the needle in there for the infusion, okay? They take in my blood, so, because before you get the chemo, they have to look at your levels to see if they need to adjust something.
Okay.
So I'm there. I have to wait at least 45 minutes for my blood, my lab work to come back and make sure that my chemo, have the right amount or whatever. They weigh me, and then I get infused. Yeah.
And how long is the infusion?
For the first 2, Taxol and Carbo. The first one is an hour, Taxol, and then the Carbo is 30 minutes.
Okay.
So all together, I'm there maybe like 3 hours tops.
So do they watch you afterwards to kind of see if you have any reactions to the chemotherapy?
In the beginning.
Okay.
because I get a bag of pre-meds that goes for about 15, 20 minutes. They
Okay.
have Benadryl in there, a lot of different
So
stuff.
nausea and things
Because
like
if you're
that.
going to have a reaction, it's going to be
Okay.
when it's,
Okay. Okay.
yeah.
And then I know you're doing the 12 rounds of the carboplatin and the Taxol, and then the last 4 rounds they're going to add some big guns on, right?
Big guns.
Okay.
Adriamycin and cytosine, how do you say it?
Cytotaxane.
Cytotaxane, and that's the strongest chemo drug. I can't wait to show y'all. I'm gonna put up my Instagram page because I'm gonna show y'all everything. So.
And I would love to have you come back on. Like, maybe we can have you come back on in about a month and see how things are going and kind of just check in with you and keep people abreast of what's going on since we last chatted.
I sure will, because I don't want this. This is a disruptor, y'all, and we should be practicing our faith anyway.
Absolutely.
That's how you got to get through it. And I'm not knocking nobody else's faith, but I think everybody needs to pick a side nowadays, because this world is just getting a little out of hand.
It is. It really is. And that's the thing, is just the fact that you had such the outpouring of, like, there's still good people out here in regards to, like, the Angel Mail. Yes. And I know we see so much stuff on the news every day, and you open up the newspaper and there's always some drama. Yes. But the fact that complete strangers are sending you words of confirmation, affirmations, and love, it's amazing.
It's unbelievable, and it makes a world of difference. And I even signed up. Look at me. I'm sick. I signed up.
Exactly.
I'm going to be sending people love myself.
And I think if anyone else on the line, go and check out Angel Mail on Facebook. Yes. If you were in line at Starbucks or Dunkin' Donuts, pay for the person behind you sometime, or pay that person's toll or something like that. Just those random acts of kindness just mean so much to people. Just the little things, I think, sometimes.
Yes, and if you have any questions, the website is angelmailproject@gmail.com, and you can ask about it. And it's just a good thing. And it's not only for this cancer. It's for people going through depression. It's just for anybody who needs some uplifting.
Okay. Perfect. Yeah. And so let's see here. So Tracy had a comment. This is Sister Tracy. Fine China. She is like fine China. Okay, Tracy, I see you, girl. So she said the medical industry hasn't changed much. And so that's why I think it's just so important that we as patients, I'm a physician and I've also been a patient. So I think it's important that we be our own advocates when we go in. I think you have to ask the right questions. If you don't feel comfortable with a doctor, find a new one.
Yes.
Reach out to people. Take someone with you if you need that support.
Yes.
And I think that if we don't stand up, then we'll continue. We'll go back to medical apartheid. So it's just key that you just take control over your medical. So let's see here. Tanisha Charmaine. So the one book is Medical Apartheid. And we'll type that in the comments for you. It's by Harriet A. Washington. I don't think there was a second book that we referenced. It was just the one book, Medical Apartheid. So I will type that here. Julia Spearman says that knowledge is power.
Yes.
Type this really quickly. Let's see here. Tracy Smith said you are your best advocate.
Yes.
Absolutely. So I guess you go by Kiki. So they say you are strong. Oh my God, your spirit has not changed.
Oh, that's somebody who know me.
That's your sister, Fine China. And then Tracy Smith, she says she loves you.
Hey, Tracy, love you too.
And then Fine China mentions that, tumors can gravitate towards sugar. I think Elise popped in because I saw someone say hello to Elise, but I think she's hiding.
Yeah.
All right. You are beautiful. Someone said great interview. As women, we're so used to taking care of everyone. Yes. You have to make time to take care of yourself. This is so true. There was a woman at the health fair yesterday, and she said she had not had her mammogram in 2 years. So, of course, I'm telling her about you. I'm telling her about the show, like tune in tomorrow. Encourage her to make her mammogram. So she said she was going to go on Monday. I was like, can you just promise me Monday morning that you'll get that done? And so by the end of the day, she probably was tired of me bugging her. But so she was like, I'm going to get that mammogram done on Monday. I have her phone number, so I'm going to send her a text and bug her and be like, oh, because she's trying to sell me some insurance too. So I'm like, did you get that? Before I signed up, did you get your mammogram? So
I missed mine. I missed 2 years.
Okay.
Did I give that out? I am.
Oh, you didn't tell us about that. Tell us about that, Kiana.
My last, and my sister would get on me, and my last was 2016.
Okay.
And I had dense breasts, but they didn't say anything.
Okay.
And skipped out on 2 years, guys. Can you believe that? Because I guess I was just feeling good. I guess I just didn't think that this could happen to me.
Okay.
I was feeling, too good. I'll go. I go. I got dense breasts anyway. I better be glad I found it.
Absolutely. And that's the thing. If we live to be 70, 1 in 8 women or 12% of women will develop breast cancer in their lifetime.
Yeah.
So it's so important.
That's a way high number. That's ridiculous. It's ridiculous.
Let's see here. So someone says that you are her, Brandy says, I love your courage and love you always. You've always been a person that smiles and laughs, so I expect nothing different. My Shiro.
Oh, Brandy.
Fine China says you're blessed. Julia Spearman, stay strong and God bless.
Yeah. And I want everybody. I mean, I just, I don't want anybody. I don't know. Am I supposed to be on Capitol Hill?
Okay. Actually, that's a great thing. I think that's something to maybe look into. And they have their advocacy days, and I think something, and I'm willing to support you in whatever way in regards to advocacy and trying to change the definition of what's routine.
Change the definition of routine. Scratch this 40 and 50 minutes. By the time you're 40, the stuff will be all through your body.
Right.
No. So,
because depending on like the American Cancer Society, some of the other societies are saying wait until you're 50, or you go from 40 to 49 every year, and everything is fine. At 50, you can go every 2 years.
Girl.
If you're healthy. So, I mean, who defines healthy?
The insurance. I'm gonna have to consult with some lawyers because I guess these insurance companies not being sued or held responsible for these false routine checkup ages. It's not right.
So again, be your own advocate. So Tracy Fine China says you're going to inspire a lot of people.
Yeah,
you're so strong and keep your glow.
Yeah, I'm hoping.
You're thanking you for your transparency.
Yeah.
Someone actually wanted you to put up the angel mail again. If you could just show the card again.
Sure. Let's see here.
Brandy signing up now.
Oh, yay! Y'all, this is, I've never seen nothing like this.
You maybe pull it back just a little bit. Maybe that might help. Okay, perfect.
On Facebook.
Then, what was the website again?
The website, let me get it. I should have had it wrote down here. Let's see. Okay. angelmailproject@gmail.com.
Okay.
Mm-hmm.
angelmailproject@gmail.com. Excellent. Yeah. Excellent. Mm-hmm. And so let's see here. Mm-hmm. So we will be sharing this on our social media as well, encouraging people to sign up. Let's see if we can get people to do that, get the word out.
Mm-hmm.
Let's see here. And then if you could give your Instagram handle again, someone would love to follow you. Julia wants to follow you.
Okay, it's Live Better.
Let me see if I can type it as you do it. Live Better.
_W.
Okay.
_faith. Live Better with faith. Mm-hmm.
Okay.
Mm-hmm. Yeah, it's in its infancy, but I'll keep adding and keep showing.
So I typed that there.
Yes.
And then let's see here. Rosemary Taylor says, thank you for sharing.
Thank you for listening.
They love you, your spirit. Let's see, we're posting the website here. Dr. Stacy says, we love you. So that's my partner down in Atlanta. We tried to get her on the line and we couldn't get that together, but that's okay.
Yes.
Let's see. Tracy's going to sign us. So if everybody tonight who's on here listening, or people that tune into the broadcast later, go to Angel Mail on Facebook and sign up. Let's make this the new norm. Random acts of kindness.
I'm telling you, for anybody, not just cancer, and they'll see once they log on, and when you can, and like I said, handmade stuff, just a little note. I mean, wow.
Tracy Smith said she's been having mammograms since her early 20s because of lumpy and dense breasts. Never too young. Thanks for sharing that
No.
with us, Tracy. Thank you so much for sharing that.
Yes.
And then
Wow.
go every year. Don't wait. Don't wait every 2 years.
Yeah.
There are places here in Illinois where you actually can go and get your mammogram and you don't need an order. So the Advocate System, South Suburban, you can actually go there. You don't need your doctor's order. You can make the appointment and you can go in and then you just let them know your doctor's name and they will forward the mammogram report to them. And so there's also places here. There's the Chicago Metropolitan Breast Task Force. And they're actually giving free rides to individuals who need transportation to their mammogram. So free transportation via Lyft.
No excuse.
Exactly. You can phone a friend. And then also we have a contest that we're running for this month. And so some of the answers to the questions may have been talked about in tonight's broadcast. So definitely tune in for that. And we're going to be posting that here on the website here in the next couple of days. So definitely take a look out for that. We will be sending out a prize. And then just in regards to breast cancer awareness, my thought is that we can't just have it awareness in October. We have to make our awareness 365 days a year if we're ever going to stamp out this disease.
Yes.
And it's not just about wearing the pink. I know what'd you call it? What'd you call it, Kiana?
They call it Pinktober.
Pinktober.
Pinktober, and a lot of cancer patients actually, believe it or not, follow Instagram. And I look a lot. They really. I can't speak for all, but some of them really can't stand it.
Okay.
They say because they feel like, October, these little pink, cute little ribbons, but it's really a devastating disease to be, living and going through. And so, but, keep supporting. I'm not saying don't do the walks and stuff, but, random acts of kindness can go a long way too.
Absolutely. Tanya Taylor says they actually offer something like that at her hospital. So I'm thinking in regards to transportation. There's also here in Illinois, we have the Illinois Breast and Cervical Cancer Program, which offers free pap smears and free mammograms to patients. So Mercy is one of the sites where you can have a free mammogram and free pap smear. It's based upon your income, but definitely we have a great breast center there, the Sheila Lynn Breast Cancer Center. So definitely look out to see what resources are out there. And I noticed in regards to financial support, the Triple Breast Negative organization, they offer some financial support as well. And so that's some digging that I'm gonna do some further digging into financial support. I may give Susan G. Coleman a call and just see what I can find out in regards to financial support for patients, because this can be very devastating financially for someone. So you're able to still work and you're still doing your PRN and
yes. When I first came out here, I was just about to start part-time at a children's hospital. So my oncologist said, babies, a little too germy, and so I just started a PRN out here. And so, I can do 4 hours, 8 hours, 12 hours. And I'm just so blessed because they are like so accommodating to me. So, I want to at least try to do 2 days while I can.
Okay.
Hey,
well, your faith,
therapist for life.
Love it. RT, you definitely need it. We appreciate you, all that you do.
Yeah. Thank you.
So just in closing, is there anything that you would like to share with the people that may tune in? Any words of wisdom, lasting thoughts?
Live better with faith, you guys. We need to live better. Let's pay attention to what we're eating. Let's just pay attention to what we're putting on our body. Deodorant, even simple stuff like that. We just don't think about all the chemicals and stuff that we're applying right to our lymph nodes. Am I not right?
You're right. You're correct. Right? The aluminum in the deodorant is thought to be hazardous.
And with faith, I don't know if we can do this life without some type of faith. My Lord, this is my faith. I'm not going to argue and make you feel bad about your faith. I just can tell you how my faith gets me through. Okay? And we got to stop. We got to stop playing, guys. It's getting rough out here. So that's probably what I would want to say, an early detection. Let's just get your tops and your bottoms checked out every year, regardless of what age. I don't, there's free places. There's really no excuse not to be aware of what's going on, because you don't want this. You don't want this cancer and lingering over your life. Yeah.
I love that. So thank you so much for sharing your story. I love the fact that you're so transparent. Your honesty, your strength, your faith is simply, simply amazing. And if there's anything that I can do for you during this journey that you're going through, I'm here. I'm planning to go on here and sign up for Angel Mail when I get off of here. So let's all live better with faith. Let's make the commitment to eat to live this week instead of living to eat.
Yes. No more papas,
Carols, and mild sauce. We're going to take a vow.
Ooh, girl, that'd be good.
With that white bread, that's the only time I eat the white bread. So we're going to control the controllable, and God will handle the uncontrollable.
Yes.
That is excellent. That's excellent advice, Tracy Smith. That's from Tracy Smith.
Yes.
So thanks everyone for tuning in.
Thank you all.
Dr. Stacy and I will be live from Atlanta next week. We will be at the Gathering Spot, so definitely tune in. And we're actually going to broadcast a little bit earlier next week. So it'll be at 5 Central, 6 p.m. Eastern. And so if you have any friends or family in the Atlanta area, tell them to come by and check us out. And Miss Kiana, I would love, love, love to have you come back and share a little bit more with us in regards to your faith walk. It's not just a journey. This is a faith walk.
It's a faith walk. I'm in the fire. I wish I could show you all. Next time I'm going to be in my prayer room.
Okay. Oh, we didn't get to talk about the prayer room. So, yes, the war room. Yes.
I go in there. I just lay right on the floor, have pillows, and my crosses on the wall.
Okay. Well, definitely you're going to have to take us on a tour next time. So have a great, great week. Thanks again. Have a lovely night.
And thank you for having me on. Thank you, Facebook.
Thank you so much. Thanks, everybody, for tuning in.
Take care.
All right. Love you, Kiana. Alrighty. Keep the faith, baby.
Thank you. Bye-bye.